We all feel sad, we all feel low, and can have loss of interest and pleasure in daily activities, but at times, if these lack of interest or lack of pleasure persist for a longer time, it's a concern. And if substantially it affects our life, our routines in any way, then it's definitely a concern. And it can be termed as depression. Depression is not sadness, okay? Depression is an illness, and depression is a common illness worldwide. With more than 264 million people are affected by it. Even a study done on Indian citizens, it states that 43% of Indians are suffering from depression, which is alarming, which is a concern. So today I'm here to talk to you all about depression, the signs and symptoms, and treatment. But before I do that, I would just like to introduce myself. My name is Tejal Dave. I'm a psychologist, psychotherapist, career counselor, and trainer by profession. And I'm in this field from almost 2 decades, and I've been trying to spread as much awareness as I can on mental health and mental illness, because I feel that India, especially lack information and awareness about mental wellness, and we need to create that. So I try my best. Okay. Before I actually get into the contents of depression, I would like you all to subscribe my channel so that I can reach out to as many people as I can and spread the awareness. You can also like my video, you can comment, give me feedback so that I can take up that topic and talk to you all about it. So let's come to the topic, let's come to the point. What are the signs and symptoms of depression? Now there are many signs, I will just tell you one by one. But at least if you see 5 to 6 signs of all the signs I'm going to tell you, that also for at least 2 to 3 weeks, then it's an alarming state, alarming concern. And then you need to go to a doctor. That's either a medical health professional, mental health professional, psychiatrist, and first get it diagnosed. Okay, these are just indicative signs. This is not a diagnosis. So you will have to go to a psychiatrist to get this authenticated and really come to conclusion that it's depression. Now, what are these signs? I'll just tell you one by one. The first, loss of interest in something that you were enjoying doing earlier. There are many times that we enjoy doing certain tasks, and all of a sudden you will realize that you're not interested in doing it. You don't enjoy it. You don't get that pleasure. You feel that you don't want to do it. If that's the case, that's the first sign. The second, you get tired very easily. Generally we have a capacity. We know that we don't get tired at certain times. We know that we can pull on for such a long time. But if all of a sudden you get tired, all of a sudden you feel there's lack of energy, you are not able to move, you're feeling exhausted, then definitely it's a second sign. Difficulty in concentrating, thinking, and making decisions. Now these are the skills, thinking, taking decisions, focusing, are sometimes natural to all of us, right? But if you feel it's hampering, there's some kind of gap in any of the thing, then that's also a sign. Loss of self-esteem and confidence. See, certain people have good confidence, certain do not have. But if you feel that you have good confidence and all of a sudden you're not confident, all of a sudden you doubt yourself, all of a sudden you're not able to express yourself, you're not able to mix around, and you feel that you are lacking somewhere, you're not worthy, it's a sign to be very important sign to be noticed. Negative thoughts about self, negative thought about life, and negative thoughts about future. You start feeling that you'll not have a good future. You will start feeling that you'll not have a good life. And you start feeling that you're not going to be happy. You're not going to have anything in life. If these negative thoughts are hampering, it's completely overtaking you, then that's something which you need to be very, very cautious about. Loss of appetite, if you don't feel like eating. Sometimes you feel that you're not wanting to eat. You're feeling that you don't have hunger. And at times it's in fact opposite. You feel you overeat, you want to eat a lot, you want to indulge in a lot of things, and you're not sure why that's happening. So either extremes probably can be a concern. Feeling guilty about certain things. If you've done something wrong and you feel guilty, it's acceptable. But if you feel guilty about everything, you start blaming yourself for everything, you always feel that I'm at fault, I've done something wrong, it's because of me, then it's a sign again. Frequent absence from work. You don't like getting up and going to work. You don't feel like meeting your friends. You don't like to socialize. You don't like to participate in anything. You don't like to do your daily chores. That's again a sign. Sleep disturbance. Either it can be at two levels. One is that you don't feel like sleeping. You don't get sleep. Other is you sleep a lot. the whole day probably, and you feel like sleeping for 12 hours, 15 hours, which is also something that's alarming. Lack of interest in sexual activities compared to previous levels of interest, again a concern. If you have frequent headaches or body aches or any kind of psychosomatic issues, then definitely there is some concern. And the last, but which is extremely important point to keep in mind, if you have thoughts of self-harm, if you have thoughts of suicide, if you have thoughts of death, major concern. So if you see people around you having these kind of symptoms, at least 5 to 6 of this, persistently for 2 to 3 weeks, don't wait. Go to a doctor. That also a mental health professional, and let them diagnose, because let them find out what is the reason. Sometimes they will ask you to go for some examination, some blood test, and then probably they will give their diagnosis. But diagnosis is important, right? Once the diagnosis is done, then definitely is a treatment. There are a lot of options, but two very important options that work for depression are medication and psychotherapy. Now, medication would help a person at definitely a very important level, but then at times your thinking is probably negative. You need to think in a positive way. You need to learn the coping skills. You need to be more rational. You need to be more optimistic, and probably because of that, because of these reasons, you need psychotherapy. So the combination of medication and psychotherapy would work wonderfully with depression, patients with depression. So last, I would just like to end my today's video, which is very short but very informative, is that don't hesitate to take help. Don't wait that it'll become all right. This is just a phase. It's just a matter of time, because the person has gone through a trauma, probably any kind of terminal illness, or because of the pandemic, or because of probably financial loss. That's why it's happening. Otherwise, this person is all right. Don't think like that. If it persists for 2-3 weeks, consult somebody, consult a mental health professional. Don't hesitate, take help. And lastly, I would like to just end it by saying that when we have fever, when we have cold, when we have any physiological problem, do we go to a doctor? Yes. Do we wait? Do we say that, okay, let it be, the fever will go, let me wait? At least you wait for a day or two. After that, you rush to a doctor, right? If you have some kind of other problem, you rush to a doctor. Mental illness or mental issues like depression is similar. You just need to go to a doctor, get it diagnosed, and take treatment. So just a humble request, please don't conclude things on your own. Take help and then let them decide what is the due course of action. Okay, and this current pandemic, I'm sure, has played a major role in the shift of our life, emotional, psychological, financial, social. That's a big turmoil. People are going through a lot of ups and downs, and I accept and I understand that. But again, I'm repeating, if these symptoms are noticed for 2 to 3 weeks, take help. Okay, thank you so much. Please spread this video to as many people as you can. Let people know that there is help available, and please help people around you come out of this, I would say, very silent kind of disorder, and that's depression. Thank you. God bless you.